Good evening. My name is Meg Wheeler. I am a candidate for the Massachusetts State Senate in the Plymouth and Norfolk District, and I'm here tonight for a COVID-19 update. I'm here every weeknight, usually at 7:30 p.m., but tonight a little bit earlier at 6:30 p.m. to accommodate another event that we have. So I did want to give you an update on where we are at in terms of numbers. So I apologize. I think I've actually grabbed the wrong thing. Let me open this up here. Got the wrong numbers I'm looking at here, and I want to make sure we give you the most up-to-date numbers. Okay, perfect. Here we go. So from a testing perspective, our statewide total is now at 76,429. That's just under 4,500 additional tests that were done today. In terms of cases, we're at 13,837 positive cases. That was an additional 1,337 that were positive today. Very sadly, we are now at a statewide total of 260 deaths today, brought an additional 29 deaths in the state of Massachusetts. So Governor Baker did announce today at his afternoon press conference the creation of a COVID-19 relief fund. This is designed to help those most impacted by this outbreak. It was launched with $13 million from local philanthropists and organizations. And the fund will actually work with other organizations to disperse this money as well. So it's being administered by Eastern Bank. It's intended to support frontline workers and the most vulnerable communities. And again, they're going to be working with community and nonprofits to make sure that those who need this money get it as quickly as possible. The state has opened multiple testing sites, one at Patriot Place that was opened last week for first responders, another one in Lowell, and then a third one in West Springfield set to open later this week. Massachusetts has received now 100 ventilators from the federal stockpile. We have requested in total 1,400. We've been approved for 1,000. So obviously this is significantly fewer than we've requested and than we need. But it is thankfully, thankfully we've been able to get some from the federal government, and hopefully we will get the remaining 1,300 that we've requested. Governor Baker is still saying that they expect the height of the surge here to start around April 10th. And Boston Mayor Marty Walsh has said that they expect the peak demand for hospital resources to happen in about 10 to 11 days. So this is why it's incredibly critical for folks to continue to stay home, to continue to practice social distancing, to wear masks if you're able to when you go out. These are incredibly important steps for all of us to take to ensure that as we work through the next couple of weeks, which everyone expects are going to be the hardest weeks, that we're able to keep these numbers as low as possible. Boston has instituted a curfew from 9 p.m. to 6 a.m. We don't have anything like that here yet in the district, but I think it's just on all of us as community members to make sure that we are going out as little as possible, again, just for the absolute essentials. On the federal level, the CDC now recommends that all Americans do cover their faces when leaving home. I talked about this a little bit in the update yesterday, but I just want to reiterate it. So you can use coverings such as t-shirts or scarves or bandanas. The idea is you want to cover your nose and your mouth. You want it to go under your chin. You want it to come up to the bridge of your nose. Medical grade masks like the N95 masks need to be reserved for those on the front line. So they are not recommending or even encouraging folks to use those masks if you're just going out. But the idea is just to have something with a relatively thick fabric to protect yourself as much as possible. As it is for the state, this is a critical week for the entire country. Several states have already run out of supplies. Many states expect their own peaks to occur at some point over the next 1 to 2 weeks. So this is just going to be a very trying time for our entire country, and it's important that we continue to practice social distancing and continue to take these measures very seriously. On the financial side, technically applications for the SBA's payroll protection program opened last Friday, but many banks have said that they are not ready to take these applications. They only received guidance from the federal government on how to administer these loans late last Thursday evening, just a few hours before they were expected to open for applications. Many other banks have said that they are limiting applications to only those from their own customers. And in many cases, they're even saying that they'll only take applications from existing loan customers, which is obviously making it incredibly difficult for a lot of people to find a bank that will actually help them get these PPP loans. So we are continuing to monitor this. As we hear of banks that do have a more open application process, we will certainly let you know. Please let us know what your bank is doing so that we can have the most up-to-date information. And if you have any issues at all, you can certainly reach out to the SBA at sba.gov, but also let us know and we can try to route you to the right resources. So just to wrap it up, I thought I would give everyone some lighthearted news. Celtics forward Jason Tatum has said that he will match up to $250,000 in donations made to the Greater Boston Food Bank. So if you are looking to give at this time, please consider the Greater Boston Food Bank. And then Boston-born actor John Krasinski has created an incredibly good-humored series, Some Good News, on YouTube. His latest episode includes a shout-out to the Patriots, who used their plane last week to bring over 1 million masks back to Massachusetts from China for our healthcare workers. So just some good-hearted news if you're looking for something a little more positive right now. Lastly, just as a reminder, I've said it multiple times, but please do continue to stay home as much as possible. Please, do not go out, do not gather in groups. Do everything you can to help us slow and stop this spread of COVID-19. And if you are able to donate blood, go to redcross.org. They have an appointment schedule, or you can choose an appointment. A lot of folks are saying that they can't find one for several weeks, which is great news. It means that they're filling up. But please still sign up, even if it's a few weeks out. Hospitals will definitely need blood even just a few weeks from now. So please consider signing up for that. And I think that's everything I've got. So let's see. Okay, so I'm going to take some COVID-19 specific questions here. So what is being done to encourage young folks to practice social distancing, as it seems a lot of folks are not taking this seriously? That's absolutely right. I mean, I've been very glad to see that a lot of people, at least in my community, seem to be taking this seriously as I've been out driving around. But I know friends in Boston who've said that there were people all over the beach this weekend, or a few days before that. And so there are certainly some people who are not taking this seriously. Governor Baker did take an additional step by closing down the parking lots at statewide beaches. That was several days ago. Mayor Walsh has put a curfew into place for Boston. I continue to call on Governor Baker to issue a stay-at-home order, which goes a step further from the existing advisory that we have now. The order not only makes it a requirement for people to stay at home unless they're going out for necessities. I want to be very clear. A stay-at-home order does not mean you cannot get groceries or you cannot go get your prescriptions or anything like that. A stay-at-home order simply means that that the only reasons you are allowed to go out are to go get groceries, for medical reasons, getting prescriptions, seeing a doctor, whatnot. Certainly if you are a frontline worker and need to go to work, that would be allowed under the stay-at-home order. And then obviously you would be allowed to walk around your neighborhood or go for a hike or anything like that. Those are still allowed, but at least if it were an order, the government, both at the state level and in our towns, would have more ability to crack down on folks who are not respecting that. So I would highly recommend that being put into place, and I continue to call on Governor Baker to do that. In terms of young folks, I think our communities are doing a good job of offering up some options for kids who are getting a little bit restless. I've seen coffee chats over Zoom. I know our Safe Harbor group here in Cohasset has put together a lot of programming. So I think it's really just creating programming, but I also think it's on us as parents and community members to make sure that our kids are not going out there. And I get that this can be tough when you've got high schoolers or college kids who are getting restless, but this is an incredibly serious matter. And I think it's important that we are all doing our part to remind each other of the severity of this and of the need to stay home. So, excuse me, I need some water now. So let's see, I have a couple of questions here. Okay, so what will you do as a legislator to help create jobs after COVID-19 passes? This is a great question. I actually talked a lot about this question on our virtual town hall we had last Thursday. related to small businesses. And you can find that if you go to megwheeler.com/events. You can find the replay of that virtual town hall. But some of the things that certainly can be done, there are a couple different buckets of things we can do. So I think the first is actually just making sure that our small businesses survive through this. And a lot has been done at the federal level in terms of the $2 trillion stimulus package. But candidly, we're seeing a lot of struggles as folks are actually trying to get those funds. So I know people who have applied for the SBA loans a week and a half ago, and haven't heard anything. People are being told, as I mentioned earlier in this, by their banks that either their bank won't allow them to apply for the payroll protection program through them because they don't already have a lending relationship, or their bank just doesn't do it at all, or the bank isn't ready to take them on. And so I think what we need to do at a state level is ensure that we are putting resources in place for our small businesses to kind of help bridge that gap while the federal government figures their programs out. So that's the first piece, because if we can keep our small businesses strong through all of this, then when we get to the other side of this, we don't have to worry as much about this huge loss of jobs if we still have our businesses strong and in a position to keep their workers on and even potentially hire. The second piece of this is ensuring ensuring that our small businesses actually have resources after all of this is over to be able to hire more people. So one of the things that I'm actually working on right now with my team is what would essentially be a financial and tax package for small business owners. I don't have more details at this point. We're just in the very early stages of crafting what this would look like. But one of the things that I've constantly talked about is the fact that we have pretty big tax benefits and tax opportunities for big companies, but not enough for small business owners. And I want to see more done for small business owners at the state level. So that's a second piece of it. The third piece certainly is to improve and put more funding into our job creation program. So whether this is training people for new jobs or actually putting money into infrastructure projects, into other projects to ensure that we're increasing the number of available jobs out there. Okay, let's see. And I've got just a couple more minutes because I apologize, but I have another meeting this evening. So, okay, so how can you cope with cabin fever? Yeah, this is a great question. And as someone who works from home, has always worked from home, or not always, but in the past 3 years has worked from home, this is certainly something that can be really tough. And candidly, I have my own cabin fever over here, so I get it. I think the best thing is to just change up your day, get outside, take a walk, go for a drive, call a friend. Don't try to avoid getting stuck in one spot, working or watching TV or whatever it may be for too long. I think that can be really challenging for folks. But I also think it is about that human interaction as well. So calling a friend or hopping on a Zoom call, I think can be very valuable as well. So those are some of my tips. Will the federal government ever enforce a national stay-at-home order? Look, candidly, I think we should have had a national stay-at-home order put into place a few weeks ago. I think that would have made a huge difference in terms of the trajectory of this pandemic. And, I understand how big of a decision that is and how difficult of a decision that would be for whomever the president is. No matter who's in the White House, but I think that's the kind of bold, brave leadership that we need right now, and that candidly we're not seeing. So I'm disappointed. I'm more than disappointed. I'm devastated that we do not have a national stay-at-home order. A few days ago, I posted about 8 states that still had not implemented any kind of stay-at-home measure, advisory or order or anything. And it's really tragic to me because it's places like that my heart breaks for those states because it's going to hit them. It has already hit them, just not to the extent that it's hit us, but it's going to hit them, and a lot of people are going to die unnecessarily and they didn't need to. And so I think in the absence of states doing the right thing, I think the federal government should have stood up and said, we need a national stay-at-home order. We need to shut it down now so we can stop this spread now. Because what we're seeing happening is we're not just seeing people get sick and people die, but we're seeing hospitals and our medical workers, everyone and everything is overburdened and burnt out, and people are really struggling and suffering. And I don't think that we needed I don't think that would have happened at the level it's happening had we had a national shutdown or national stay-at-home order a few weeks ago. So I don't know if they ever will do it, but candidly, I think at this point, I don't know that I think better late than never, I suppose, but I think we've missed the window to where it truly would have made a difference. I hope they still do it, because I think it'll make it less worse than it would be otherwise, but I'm very sad to say that I think they've missed the window on this one. I've said this before, I don't think Governor Baker has gone far enough. I appreciate that he and our state have put some good measures in place. I think overall, as a state, we've responded better to this than other states have. I'm very grateful to everyone who has worked to ensure that we have quality information every day, that we're continue to be updated every day, that steps are being taken to keep us safe every day, even to private folks like Robert Kraft, who have used their resources to bring us the PPE that we need. But at the end of the day, I have said from pretty much the very beginning that we need a stay-at-home order, and I think that needs to happen on a national level. So, okay, I'll take one more question just because I do need to wrap it up. But what advice would you have for folks with longstanding health issues who are afraid of the future? Excuse me. So I think so I guess I would say a couple of things here. So I'm not sure exactly what you're asking, but if it's folks who have health issues and are worried about what's going on right now, the advice I would give, or what I would say, is to please stay home as much as you're able to. If you have any kind of underlying health conditions and you're able to have someone else go out and get your groceries for you, get your medicine for you in a safe manner, please do that. If you are not, our volunteer team has been reaching out to folks all over the district to check in and just make sure people are doing okay. And we were speaking with a woman today who has a friend who's elderly and is unable to leave the house to go get food, and she only has a few days left of food. And so, we were working with her to get her resources to have someone bring her food. So if you can have someone do that for you in a safe manner, great. I will tell you, in our own house, even though we don't have underlying health conditions that we're worried about, we've set up a table in our garage. Anything that comes into our house goes on that table, gets completely wiped down. We have gloves on, we take our gloves off. We wipe everything down that we've touched before it comes into the house. It's just another precautionary measure to ensure that, we're not bringing anything into the house that could potentially harm us. So that's sort of the short term. From a long-term perspective, we need better access to quality, affordable healthcare. And, I 100% believe that healthcare should not be tied to your job. I think we're seeing right now the detrimental impact of having healthcare linked to your job, with so many people out of work right now, people who have been laid off, who do not have access to healthcare any longer. We're seeing now why that is such a bad idea. So number one, healthcare should not be tied to your job. Number two, we need a healthcare system that frankly cuts out the middleman. So this is why I am a supporter of Medicare for All. Because I truly believe that, and I've seen the numbers. I'm an economics person, I'm a numbers person. I've looked at the studies, and to me, there is absolutely no question that if we switch to a Medicare for All system, costs go down, both for the government and for us as individuals. And it allows us to get people the quality healthcare they need at a lower price, a price that people can actually afford. So that we can stop having people go into bankruptcy because they have so many medical bills, or not go and get the medical care they need because they cannot afford it. So that is completely unacceptable. I think this current situation is exacerbating that, and we're truly seeing how dangerous of a policy our current healthcare system is. And I think we need radical, immediate change. So I'm hopeful. That's obviously more of a federal level change, although there are things we can do at the state level, but I'm hopeful that we will see movement on that after this. And so that would be, for those folks, I would say, come help us join the fight. Vote for people who are fighting for Medicare for All. Be a volunteer if you can for the organizations that are trying to educate folks about Medicare for All, because that truly, getting quality, affordable healthcare in your hands, in my opinion, is the best thing we can do to ensure that your future is bright and is not something that you need to be afraid of. So, all right, I'm going to go ahead and wrap it up. Thank you so much for joining this evening. For everyone who's watching live, if you are watching the replay and you have questions, feel free to drop those questions in the comments. I'm more than happy to answer them. And again, we do have a resource page, megwheeler.com/COVID, where you can find more information and more resources as they become available. I do want to just wrap this up, as I always do, by sending an incredibly big thank you out to everyone who is on the front lines of this, fighting for all of us so that we can stay safe and healthy. Our medical professionals, our doctors, our nurses, our hospital staff, everyone on the front lines, our police departments, our fire departments, excuse me, everyone who's out there in our grocery stores and our restaurants and our gas stations and our post offices and our truckers, making sure that we have the things we need so that we can get through this crisis together. I am truly incredibly grateful for everything you're doing, for the risks you're taking, the sacrifices that you're making. You are truly the heroes of this very tragic story, and I will continue to fight for you when I'm in the state Senate and forever on. So thank you very much for everything you're doing. And again, if there's anything at all that you need, please reach out to us. I will be back here tomorrow night at our regular time of 7:30. I'm here at 7:30 p.m. Eastern every weeknight. So I will see you all then. Stay safe, stay healthy, and we will get through this.